Hi, hello, my name is Zim, and I'm a health informatics consultant, and I'll be evaluating the systems associated with this organization. I will also create a plan to tackle the clinical support decision in this organization with these following slides. So what are the key evaluation questions? Time consumption, error reduction and diagnosis formulation with workflow improvement. With the ever increasing need of decision making process, we need to evaluate certain parameters pertaining to the issues faced with this organization's current CDS. This evaluation aims to inspect and implement the new measures that will improve patient care in the organization. Safety of use will highly be considered when we use the CDS. One of the main key for this evaluation is to see how workflow can be improved among staff members and how far into the future this workflow will evolve seamlessly. The stakeholders for this would be the clinicians, the clinic staff, and also the IT department, billing, etc., etc. This the stakeholders, you guys play a vital role to the success of implementing and evaluating the current system that's going to be used for this organization. For this outcome to be achieved, a strategic approach needs to also be implemented for the success of this evaluation. Like I said, the clinicians and the clinic staff, you guys will be on the front line of this evaluation. And this is because this is going to fuse your scope of practice and technology to come up with correct diagnosis and also to provide seamless patient care service. The IT department also plays a vital role. This is because they're the ones to provide assistance to the clinicians or the clinical staff, say they have issues with technical issues basically. The CDS tools that we're going to use for these evaluations are order sets, alarm and reminders, clinical practice guidelines, support for diagnosis, and alert to preventative care. For this evaluation, we will utilize. We already said 5 of them already. So the order sets will help the clinicians to give appropriate testing for patients. Take for example, a patient comes in for chest pain and high blood pressure. And of course, the clinician would definitely order blood work for this patient. For example, check the cholesterol panel or the kidney and liver functions to see if they're still, to know what's going on. And at the end of the day, the doctor can come up with a diagnosis that, hey, this patient has hyperlipidemia, and definitely make arrangements for medications and also, further blood work, in the future to see how the levels are going to play out. Alarms and reminders, this is one of the most utilized CDS tools. Reason why I said so is because it gives alert to the doctors. Say for example, the doctor orders 2 antibiotics that have contraindication with each other. This alarm and reminder will help the doctor to be like, hey, doctor, you giving this medication, giving that medication, talking, both of them cannot go with each other. And it's left for the doctor to, take caution because it's an alarm. Clinical practice guidelines, it often makes sure that the organization follows certain set of rules and practices to ensure safe patient care. So pretty much, it's understandable. And also for the support of diagnosis, the clinic, like as earlier said in the example, when the clinician finds various solutions to tackle the patient's diagnosis, the doctor or the clinician, at the end of the day, orders like further blood work, like come back in 3 months, repeat your blood work, and you know, send medications every 3 months just to check the range of the blood work or to know if the patient is getting better or not. Alert for preventative care. It alerts the doctor, say for example, hey, this patient has 3 months follow-up. you need to do this, you need to do that. You know, it helps the doctor to prepare on what to do for the patients for when they come back for their follow-up, pretty much. The benefits of using these CDS tools: number one, it saves time, it reduces errors, and it formulates diagnosis and improves workflow. Why do I say that? Time management is very important in, you know, our work, and we don't want to have play with certain data that will put us scattered across. So we need to save time to accomplish certain tasks. Error reduction, yes, we need to also reduce errors, because a little error can actually, you know, it can kill a patient. So we have to be cautious about, you know, errors that we're making. It also helps to formulate diagnosis, like, you know, when we said earlier, doctor collects blood and boom, whatever data, subjective, objective data the patient has, it helps the doctor to formulate a diagnosis. And it improves workflow, because once, you know, there's time management, definitely the workflow improves, because you're not going to spend so much time doing one task or another. The approach that will be used, that we consider using this system, will be, you know, providing appropriate training, simulation practice, inspect possible problems that may arise in the future, and implement protocols to achieve successful outcomes. Reason why I said so, the important one here will be simulation practice and appropriate training. Yes, these two are really important, because it helps to sharpen the skill of whoever that is performing any task, so that they cannot commit any errors. The next one will be, how do I prioritize the team efforts? So we can prioritize the team efforts by creating tasks, evaluating the team's effort, and also execution of the task. So when given a task, we create a new task, evaluate the teams. You know, you have to evaluate everyone. Like, hey, you can't just give a task with someone that's not capable of doing it. So you have to evaluate, definitely. And then once the task has been evaluated, it's left for the team member to execute the task to the satisfaction of the company or the organization. The only theory I chose here was a change theory. The reason why I chose a change theory is because when implementing systems like this, we need to open our mind for change, because if there is no change, if you don't have the mindset of changing, you won't be able to advance, or you be stuck in one place. So definitely the change theory is very much applicable to this system. And yeah, with all of this, I hope my presentation was good for you guys, and I hope to see you guys on my next presentation again. Thank you.